Welcome back, ladies and gentlemen. I am Manali Kulkarni, nutritionist at Endoclinic, Pune. I welcome you all to the journey of life-changing thoughts about diabetes. Previously, we discussed about what is diabetes reversal. In the next video, we are going to discuss about why only few people get really good result in terms of diabetes reversal and few people may find difficulty. Let's get started with our expert diabetologist and endocrinologist, Dr. Anjali Bhatt.
So this is a very interesting question that even scientists and doctors are trying to find out, that why only 50% people will show a very good response and the others will not show that good response. The percentage may not be 50% in all studies. In some studies the percentage is higher, in some studies the percentage is lower. But basically what we are looking at is correcting the mismatch between metabolic capacity and the food that we are taking. We saw this in the basics of diabetes in the first session. And when we are changing the food or lifestyle or nutrition, we are only going through one aspect of it. Now looking at what all can also affect the metabolic capacity, what decides or what are some of the factors that we know that decide what a metabolic capacity of a person would be. Now these factors start from the genes that you are born with, the exposure that you receive in terms of nutrition when you are in your mother's womb, the exposure of the environmental factors including food when you are a child, when you grow up, how much weight do you gain. It will also depend on some factors like how sincerely and seriously the diet is followed by the patient, whether that person accepts that particular diet or requires some changes in the diet. So some factor decide the metabolic capacity of a person. We know some of the factors, and how do we know? We can check glucose levels, we can check insulin, we can check C-peptide, which is another molecule that is secreted along with the insulin in the body. Sometimes we can see fat deposition in the liver on sonography. We can see fat deposition in the pancreas by doing MRI. All these investigations are not routinely required when we are trying reversal of diabetes. But if we want to know why things are not changing, then these factors can be seen. It also depends at what stage we started the process of reversal. Because after exposure to excess fat or after exposure to certain environmental factors for a long time, the body might become or might go in a stage from where the reversal may not be very effective or possible. Generally this occurs when the pancreas of your body have irreversible loss of the capacity to secrete insulin. And then medications would be very much important to reduce your blood glucose levels if the reversal is not successful or if you are not able to achieve the normal blood glucose by just changing the nutrition and lifestyle.
Thank you so much, ma'am. In the next video, I would like to know more about what is diet in general and which is the best diet for diabetes reversal.